But the damage, if you want to say it that way, it has been happening before. You know, we cannot underestimate that even I would say the situation or the whole character in which both parents come into the pregnancy, even before the conception, the state of both parents, mentally, emotionally, and physically, you know, that it's not taken in account. It's really silly in a way, because, you know, you have the product of two parents, you know, two adults, and obviously the health in every way, mentally, emotionally, and physically, of both of these people has to be taken in account, because that's the creation of that particular child. We cannot just think that, you know, two unhealthy people, I am amazed actually, that still a healthy child can be born, obviously, you know, but it starts there. I mean, we have to really look at that. And if anything, when they always talk about being proactive and trying to prevent autism, they have to start looking there. You know, it's not starting to look when they are born. You know, because the interesting thing is that if they really pay attention, and, you know, I had seen so many children, when you ask the mother, often the mother would say to me, I knew something was wrong with my child. I could see it in the first month already. You know, the early signs, so to speak, of autism. But obviously, as you know, it's always around year 2.5 that the child gets diagnosed. And which is important even for allopathy, because they always stress the fact that early intervention is, of course, very necessary to be successful. But for them, early intervention is after they are born. Okay? So it is very interesting. I saw all these particularly, I looked at a lot of studies that were done by allopathy, and they all focus on after the birth, which is in a way not understandable. You know, and especially when we think about emotions that can happen, you know, during the pregnancy, which happens all the time. You know, the moment, even the first question I always ask to parents, what was your first reaction when you knew you were pregnant? The mother, of course, first, right? And the answers to that can be many-fold. You know, but like accepting it, being joyful, or actually saying, oh my God, not the right moment, it makes a tremendous difference. Even allopathy has done some excellent research as they went further then, to even say that, you know, certainly when the father, for instance, is not really always nice to the mother and during the pregnancy, when they're really basically not accepting it or anything like that, that it has a tremendous influence on the development of the child. Now, what they call the dialogue, the psychological dialogue between the mother and the child, the unborn child, is extremely important for the development, and that is just a given fact and truly accepted even by allopathy, that it plays an enormous role. But they really don't know how. They really don't know if we would ask them, so what are the emotions then that are the most important to avoid? It's hard for them to say this, although we do have, as you know, a whole array of stressors. We have these charts of stressors, even in allopathy. Now, number one, what's the number one stressor? It always number 1 and 2. It always comes down to problems between father and mother in the family, always. You know, whatever the stress is. Nowadays, even worse with people losing their homes and their job, creates additional stress. Once a child is born, the stress is absolutely enormous. Unfortunately, mainly for the mother, and even in the United States, up to 80% sometimes of the parents divorce with a child with autism, which, as you can see, makes the task for a homeopath very difficult, because you're trying to help, but in the meantime, you have to focus on the child, but you must understand you have to focus on both parents at the same time. Too many times, it is the very difficulty for the homeopath that sometimes and very often, unfortunately, there are exceptions, of course, always, is that the father really, it's hard for the father to accept a child with autism. The mother is much more, you know, because they have more of a feeling function, we call it conscious function of feeling, rather than a thinking function. Men in general have a very hard time dealing with it. Often they might not ever even mention to any of their friends they have a child with autism. Okay, so so they want to believe most of the time that it has to be, well, they like it if the vaccination theory, because that, you know, it's like absolves them from anything else that they were not. It's not for me to be out there to accuse them of anything, but you can't really all of a sudden neglect emotions. You know, we accept, if you think about it, we accept very much factors like smoking, drinking, lack of nutrition during the pregnancy, that it can definitely have an influence on the child's development, right? But that we don't want to accept that emotions happening to the mother, and really severe emotions, that would not be having an influence. It's amazing that we can actually try to deny this. But you understand why. Because it's more painful for parents to think that they might have been involved somehow in the making as a trigger. You know, they often feel really already very conscious about all this and guilty. And it's certainly not for us to try to instill more guilt, but the bottom line is you can also not be blind. So, and I'm not talking just about autism. So when I talk about these triggers, the exterior and interior environment, it's not just for autism. This is just for any disease, regardless what the name is. Mystery disease or non-disease. You know, this is interesting too for me, having studied traditional Chinese medicine too, that 5,000 years ago, when we compare the triggers that the Chinese medicine brought forward, and compare it and put it side to side with the homeopathic triggers, they're absolutely, totally identical. And basically it was always accentuated that the emotions were absolutely the number one very important factor. Okay, that you could not just really put this away as we do right now in allopathy and, you know, forget about it. You know, no, it has to be either the genes or it has to be now environmental factors. So in other words, in allopathy right now, we went from bad parents to bad genes, and now it's the bad environment. It's very strange to me how anybody can just take that aside and not connect all of it, because obviously all three can play a role, different from person to person, obviously the intensity, the amount, but you cannot just say the emotions, we're never going to look at it. We're going to just look at the environment now. It's understandable, like in allopathy, that they can't really start saying maybe we should give any pregnant mother Prozac or Zoloft or anything like this. You know, for them it's theory. I mean, the practical things again, therapeutically, they're really much more at a loss than we in homeopathy would be. Because as you understand, in homeopathy, even more than in traditional Chinese medicine, we can treat the pregnant wife, and we always should. Because even during that time, the pregnant woman shows us much more what is needed, and obviously at the same time needed for the child, than in any given other moment. So we should really take advantage of it, and really, for me, trying to avoid this being proactive. Even if the conception is already done, you still can do a tremendous amount of work, 9 months, that you have the time to try to really correct whatever you see, you know, no doubt about it. So this is the interesting thing for me, where there's so much more to say about autism, of course, and it's just the beginning of the whole story. But where allopathy stands, how can we use allopathy for us to make it even, you know, that we understand homeopathy, other modalities like traditional Chinese medicine, even psychology, you know, you can bring it in, Jungian psychology. You can use this, and it's very important because one of the things, as you might know, the cardinal symptoms in autism is obviously the lack of social contact that they make, right? That the child basically is not acting socially what is expected from the child. Connecting to the adult's world doesn't always happen, unfortunately. And it's certainly one of the most devastating symptoms for the parents. But this can now be understood from our standpoint, and you must understand, if we can explain to the parents, this is why your child escapes in a dream world,